So the reason why I'm doing this is because Pregnancy After Loss Awareness Month is March. And this is a very important topic to cover. So I wanted to talk to her because she is a good resource. And let me see if I can add her. She is a great resource, and it's not letting me do it. Okay. And please go over to her on Instagram at Healthy High Risk Pregnancy. Parijat, Parijat, last name Deshpande, and get more information from her. But apparently I can't add her. So I'm just going to do as much as I can and answer as many questions as I can, and you guys can ask questions here. So basically the reason why I think this is important is because a lot of women experience pregnancy after loss. The one website that I continually go to get more information is pregnancyafterlosssupport.org. And that is a great resource for information and support groups and answering questions for any of you guys who have experienced pregnancy after loss. But I'm also going to start with just a few stats. The first is that in the United States, 1 in 4 pregnancies end in miscarriage, and 1 in 160 end in stillbirth. Women who experience a pregnancy after loss, of those, 50 to 80% of them will experience pregnancy after loss. 50 to 80% of women who experience a pregnancy after loss will become pregnant within 12 to 18 months. And then number 3, women who are pregnant after loss report having higher symptoms of anxiety, depression during their subsequent pregnancies and in the postpartum period. And then also many women will experience grief, confusion, anxiety, guilt, and fear of loss in a subsequent pregnancy. Then finally, we can't forget that our partners, even though we may be the ones physically experiencing the pregnancy after loss, our partners are subject to having these feelings as well. So we cannot forget about them. And just real quick, Parijat is on here answering questions. If you guys have any, she put on here that she's on Instagram at healthy high risk pregnancy. And she also recommended going to pregnancyafterlosssupport.org. So first question, I was going to ask her, but I want to answer this question based on what I know as a medical professional and as a woman who has experienced pregnancy after loss. The first is, why is a pregnancy after loss subject to stress, anxiety, and even depression? Well, as the one stats reported, 50 to 80% of women who experience a pregnancy after loss will become pregnant again. And a pregnancy loss, no matter what gestational age, whether it's a chemical pregnancy, whether it's a first trimester loss, a second trimester loss, a third trimester loss, a loss is a loss. And women feel that, and they can have anxiety and become depressed as they would with any loss in their life. Pregnancy, a woman who has lost a pregnancy can definitely go into depression and have anxiety and stress. And every individual is different as far as how long that takes them to get to the other side. They may not ever completely get over it, but every person's different. If they become pregnant within 12 to 18 months, they may not be finished grieving. And now they have a new pregnancy. So now they're conflicted. They're pregnant, they want to be happy, but they're still grieving the loss that they just had. I went through it myself. I had a miscarriage, I had 2 failed embryo transfers, and then I became pregnant with twins. I was depressed during my pregnancy, there's no question. And I had terrible anxiety during my pregnancy as well. So I totally get it. It is hard to experience this, the loss, and then it's also hard to become pregnant afterwards because you have so many different feelings. So that's why a pregnancy after loss is subject to having feelings of stress, anxiety, and depression. The stress and anxiety, of course, is over worrying about whether or not the current pregnancy is going to end in a loss. Just stress and anxiety over that. And then the depression can be pre-existing, meaning you were already depressed before you got pregnant due to the loss that you had, or you have had a history of depression even when you weren't pregnant and then had a loss. So it continues going and going. And then if your stress and anxiety can get too far out of control, then you could also have depression. And then Parijat just added it. She said, so true, such conflicting emotions. And that's exactly right. You're conflicted. I'm pregnant and I want to be happy. However, I don't want it to take away from the loss that I had. And I don't want it to seem like I'm not still grieving, or that now that I'm pregnant, everything's better and I'm happy and I'm not thinking about that loss that I had. So we are conflicted as women, experiencing that over the loss. So it's a difficult time. It is a difficult time. The second thing is, what are signs of anxiety and depression, and when can this occur? So anxiety and depression can occur before you even get pregnant. It can occur during the pregnancy itself, and then it could be exacerbated or even present itself in the postpartum period. Because not only can you be concerned that you're going to have a pregnancy complication or suffer another loss during that pregnancy, but you might feel that it could happen after the baby's here. And that's common for women who even haven't experienced a loss before. A lot of women start to have stress and anxiety after the baby's here because they're worried about losing that child for whatever reason. So some of the signs of anxiety and depression: if you are, if you have a history of anxiety, then or in depression, you know what your baseline is, and a lot of women can tell when they're having an exacerbation of symptoms. And Parajet just added, yes, I love that you shared it. It can happen at any time. That's right. It can happen at any time, before pregnancy, during pregnancy, and after. It can happen at any time. So depression, meaning, you're not feeling happy. It's hard to do your normal activities. You're not as productive. You can't get out of bed. You're sleeping too much. You're not sleeping enough. You're maybe having palpitations, which could be a sign that you're having panic attacks. Or just anxiety in general. You can't do things that you normally might be doing to prepare for the pregnancy because it's just too stressful, or it makes you too anxious. So the signs for stress and anxiety, again, can occur at any time. So this would have been I would have loved to have her on here for this. How can women decrease the stress and anxiety during a pregnancy after loss? I think the first, and I'm not an expert at this is her area of expertise. The first thing you have to do is to recognize that it's happening, and understand that it's happening, accept that it's happening, and do something about it. I tell my patients all the time who are having stress and anxiety during pregnancy, if you tell somebody, namely whoever's taking care of you in your pregnancy, that you're having stress and anxiety, it does not mean we're going to write you a prescription for a medication and send you on your way. That is not a knee-jerk reaction of most providers. I'm not saying that some providers don't do that. But some women are afraid to say that because they're afraid we're just going to give you a pill and tell you to go take it. That's not true. Any good provider is going to talk to you about it and try other methods first, unless you have a history of it outside of pregnancy and you've already been on medications in the past and you knew certain medications worked for you. Then we may say, you know what, you might want to start back on those medications, okay? That's kind of a different scenario. But if this is the first time you're experiencing it, we may talk to you. Just talking to your provider might be enough. We might ask you to see a therapist first to be evaluated because, the general obstetrical care provider may not be equipped to do the kind of therapy that a woman might need if she's having anxiety and depression in pregnancy. So every provider should have resources available to help you. If it gets to the point that you need a medication, I want you to know, if it gets to that point, okay, that the therapy may not be helping. Some of the other measures, and we'll talk about that, may not be helping, and it is determined that a medication is needed, you can take that medication, okay? A healthy mom, physically and mentally and emotionally, is what's important, okay? If a woman is not healthy emotionally and mentally, that can be just as damaging to a pregnancy as anything you might hear about taking an antidepressant or anti-anxiety medication. So I want you to know I'm a maternal fetal medicine specialist. If you need the medication, take it. Parajet just added, love your practical whole health approach to this. It is a whole health approach to this, okay? It's a team effort, but I want you guys to feel comfortable talking to your doctors and not withhold because you're afraid, A, we're going to judge you, B, we're just going to give you a pill and send you on your way. Everyone that's experiencing anxiety and depression does not need a medication, but some of us do, okay? What else does she add here? Anxiety and depressive symptoms in a pregnancy do require a different approach, so be sure to see a specialist. So yes, again, any doctor, obstetrical care provider, if they are not comfortable with this component of a woman's health and pregnancy, meaning stress, anxiety, and depression, they should have resources available. I'm going to say this: if they don't, find someone who does, and that's okay to do that. She just added 100% of mom's mental and emotional health can impact a pregnancy too. It's critical to address. So she agrees what I said. Everybody thinks that diabetes, hypertension, and all this is what's going to harm a pregnancy. That's not necessarily true. Yes, they can. But a woman who is not mentally and emotionally healthy, that can also be dangerous to a pregnancy as well. So we need to be healthy in all ways. And so I will tell you, one of the weaknesses in obstetrical care providers is a lot of them are uncomfortable addressing the mental and emotional health of a woman, because we as medical students, I can speak for only medical students, we don't get as much training in that. I got a gazillion hours of training on how to treat diabetes, hypertension, lupus, all of this in pregnancy, but I didn't get as much training on how to treat stress, anxiety, and depression. I'll be the first to admit that. So all of us should have resources available. Parajet just added here, she has lots of information and resources. She does have a book called Pregnancy Brain. You can go to that pregnancybrainbook.com. It's also on Amazon. I did purchase this book for I have resources for my pregnant patients, and that book is on my list. Again, Pregnancy Brain. You can go to pregnancybrainbook.com, and you can get her book, which is amazing. And you can also get it on Amazon. So I'm just going to stop, taking a minute. I'm going to go back and answer some questions that were asked earlier. Let's see. What are some techniques you used or recommend to deal with anxiety? I'm currently 5 weeks with my 4th pregnancy. No living children. I now feel like anxiety might be adversely affecting my baby. So Jenny, I get it. You're early in the pregnancy. If you're feeling this stressed and anxious, I'm going to tell you, see a therapist. That doesn't mean I'm going to stress, doesn't mean someone's going to place you on a medication. But they can evaluate you. We can try therapy first, and if that doesn't work and it's determined that a medication would help you the best, then that's what needs to be done. So some techniques, again, this is not my wheelhouse. Again, I didn't have a lot of training for this, but stress and anxiety, having a good support system is very, very crucial. Communication with your partner or someone in your family or friends that you feel really listens to you and you feel safe talking to is important. Women with recurrent pregnancy loss, such as yourself, have a lot of stress and anxiety. Acupuncture helps. So these are some of the conservative measures that can help. Talking to a therapist, having a support system, acupuncture, meditation. There's a lot of things that you can do. And you can also go to Parajet's book, Pregnancy Brain, which you can get on Amazon, which has some resources as well. But start with talking to your obstetrical care provider and let them know how you're feeling so that they can help you, okay? And if they can't themselves, they should find someone who can. You don't want to go the rest of your pregnancy, Jenny, feeling this way, because the stress will adversely affect your pregnancy. So I hope that answers your question. I'm going to go down a little bit more to see what else has happened. Jeannie, I wish you had as a resource 3 years ago after losing my baby at 22 weeks. I was on hospital bed rest at 21 weeks with my twins and almost lost them more than once. I came out on the other side. I had them at 31 weeks, but I understand the stress. Also, as a high-risk pregnancy specialist or maternal fetal medicine specialist, I deliver women in your situation all the time, and it's awful. It's awful for me as a provider to see women go through this, so I can't imagine what it's like for you and other women like you to lose a baby like that. So I hear you. I hope that you're getting some help. You can private message me if you're needing some information on if I have any contacts in the area you live in, if you're needing help now. I just want to say here, ladies, seeking help is not a weakness. This is 2020. So much has been done on social media and by notable people, athletes, actresses, actors who have come out with their struggles with mental health disorders, stress, anxiety, depression. And yes, that's great. There's everyday women like yourself and myself who've been through it too. So it's okay to get help. It is not a weakness. It's better to be, since you've had your loss, Jeannie, to get yourself as emotionally and mentally prepared should you get pregnant again, okay? So please seek help. I'm going to keep going down. I would love for you to check out Pregnancy Brain. Okay. Let's see what else. Angela talking about Parajet's book, Pregnancy Brain. That book, it's amazing. After my daughter died at 23 weeks, I bought this book. It helped me through my loss, and I'm sure it will help me on my journey to try to conceive. So, Jeannie, you may want to pick up that book, Pregnancy Brain by Parajet Deshpande. It's on Amazon. You can get that there. Jenny said, Parajet, I was actually in the middle of Pregnancy Brain when I had my last miscarriage last year. I should probably go back and finish. So, yeah, go back and finish the book. And then Parajet just added, seeking help is not a weakness, 100,000 or 1,000, 10,000% yes. So she's in agreement with me. I think we all need to understand that mental and emotional health and wellness is just as important as having good blood pressure, not having diabetes, having good cardiovascular health. It's all the same. It's just that for so long there was such a stigma, and especially with certain populations, and pregnant women being one. And I just want to say this: when a woman is pregnant, she is expected to be happy all the time. You're pregnant. Why would you not be happy? You're bringing life into this world. You should be happy. But the truth is, not everyone is. And that's okay. We stress, we worry, we have social circumstances, we have problems with our other children, we've had pregnancy loss, we're working moms, there's so many reasons why we may have stress and anxiety and depression in pregnancy. So if you're feeling that, do not feel ashamed to let someone know. Okay? And for anyone who tells you that you shouldn't be feeling stress or anxiety, that's someone that you should not have in your support system. Okay? So it is completely normal for women to have these feelings in pregnancy. Okay? Again, traditionally, pregnancy is supposed to be the happiest time in your life, and it's not for every woman. Okay? Some women, it is. For me, it was not. I was incredibly stressed and anxious and depressed. Okay? So what was Parajet saying? Oh gosh, yes, I think you hit on a really huge misconception that grief and gratitude cannot coexist. Grief and gratitude in a pregnancy do coexist. So especially in a woman who's had any trouble, and pregnancy after loss, yes, but also women who have had an infertility, okay? She's adding, we can be grateful for the rainbow baby and still be grieving our previous loss, and that is true. I have twins who are 3.5. I still grieve the miscarriage that I had and the pregnancy losses that I had with IVF. I do. I think about them. Okay? I have 2 beautiful babies who bring me so much happiness, but sometimes I can't help but think about it. And I know that some of you guys do too. Okay? But that doesn't mean I'm not grateful for the 2 children that I have. I am so grateful for them. But a loss is a loss. Okay? And I think we all need to acknowledge that and accept it. Let's see, how can you find a good support system? So, Parajet, you might want to chime in. How do you find a good support system? For me, it was hard. And I think for everybody it's hard. But you got to find those 1 or 2 people. And it may not even be your partner. It might be your mom, your sister, your friend. For me, it was my single friends and my sister who went through everything with me, okay? So you just got to find those people that you feel comfortable being vulnerable with, okay? And if you don't have those people who are physically there with you, there's so many resources online now. You can actually even get online counseling, okay, to help, especially for women who've gone through infertility and loss, okay? I will post soon some information on how to find these online counselors, and I think Parajet had given me some information. If you want to throw some stuff up there, I can relay that to the audience. There's so much available online as well to help women who don't actually have support systems that they can physically talk to and touch and feel. There's a lot of support systems online. We've already touched on the guilt that women feel during the rainbow baby or the pregnancy after loss. A lot of women do feel guilty. And I know I did, and I still do to some degree. But the one thing when I look back, when I was pregnant, that I wish I had done, and I didn't really do, is I didn't celebrate my pregnancy. And I always tell women this, celebrate as much as you can. And celebrate doesn't mean having a gender reveal. It doesn't mean posting stuff online. It means how you're mentally celebrating your pregnancy, how you're connecting with your pregnancy. Whether you're just talking to your babies, whether you're just sitting and being with them, they're celebrating, acknowledging your pregnancy so that you could start to bond with that baby is so important. And I wish I had done that more. I'm going to take a break to read some of the comments that came up. Yes, Parajet is saying there are so many resources in person and online. She says, she does virtual consultations, and my virtual group program for trauma and grief healing is opening soon. So please go, can you, Parajet, just throw up there again what your website link is so I can tell everybody. She's also saying there's lots of therapists online. So Parajet does virtual consultations, and she has a virtual group program for trauma and grief healing that is opening soon. I will tell you guys in a second what that link is, so you guys can go to get some information from her. Let's see, address that being along the same lines of celebrating your pregnancy. Being excited during a pregnancy after loss does not take away from the pregnancy, previous pregnancy or pregnancies that you did lose, and it doesn't mean that you don't care about those losses. It's hard. We've talked about this, having grief for the pregnancies you lost and joy for the pregnancy that you're having is conflicting, and that's normal. But it doesn't take away from the pregnancies that you lost. As she's saying here, Parajet saying celebration can be as simple as acknowledging the baby, talking to the baby, singing to your baby. It doesn't have to be anything elaborate, whatever feels safe to you. So the one piece of advice I have is to please celebrate your pregnancy as much as you feel comfortable and as much as you can. She's adding that her somatic, traumatic, and grief healing program is called Healing Hearts. The website is parajetdeshpande.com /healing hearts. Okay, so go to that resource for more information. How to celebrate. We've already talked about how to celebrate your pregnancy, and I gave some tips for myself. If anybody is on here and has some tips on how to celebrate your pregnancy, let me know. So a question just came in. It's not really related to this, from Megan. Is hyperemesis high risk? Not necessarily. Hyperemesis is a significant condition that just means you have significant nausea and vomiting in pregnancy that may require hospitalization. It's usually gone by at the latest 20 weeks or so, but some women do continue to have nausea and vomiting in pregnancy throughout the pregnancy. So as long as you're being treated, it's important that you do that. Okay, so and hyperemesis, majority of the time, does require that you do take medications. So if you do have hyperemesis and your providers are recommending that you take medication, you should take it. So Jenny, is that program appropriate for pregnant women? I'm in therapy and taking meds. If you're speaking about the program that Parajet has, yes, it is. So if you're looking for something adjunctive, please go to her website, parajetdeshpande.com, PARIJATDESHPANDE.com. /healing hearts, but you can also see all the other resources she has as well. That's all I have. Again, I do apologize, guys, that this did not work out. I'm going to get back with Parajet and talk more about, we'll schedule an Instagram live session, because apparently you can do that. Okay, wait, so she's saying, I don't recommend Healing Hearts for men who are currently pregnant, but I will have a pregnancy safe version coming out early April. If you email us, we will let you know as soon as it's ready. So, Jenny, she's saying the Healing Hearts program is not for women who are currently pregnant. So email her, go to her website and email her. And in April, her a new program is coming out. Okay. Katya, trying to conceive again after early miscarriage. I know that the miscarriage was 99.9999%. Not my fault, but let's see. But that one deep corner of my mind wonders if we are, fingers crossed, successful, what resource do you recommend to make sure I'm not doing something potentially harmful? I find out hibiscus can be harmful, all sorts of topical creams, the list goes on. Also, sidebar, okay, so I am a huge advocate for acupuncture. Katya, if you're asking about acupuncture, I am a huge advocate for acupuncture for stress and anxiety. I do think it helps. But I want to tell women this. pregnancy loss, unless it can be attributed to, and I'm just going to put that, unless it can be attributed to illicit drug use or that you were doing something dangerous, it is not your fault. And taking hibiscus is not going to cause you to miscarry. Walking, running, unless it's contraindicated in your pregnancy, it's not going to cause you to miscarry. So there's really not anything I'm going to tell you that's going to, you can't do X, Y, and Z if you're, going to get pregnant again, or it's going to cause you to miscarry. That's simply not true. It is our nature as women to blame ourselves for everything. We take on a lot of responsibility for everything, including when our own body fails us, as we might feel when we've lost a pregnancy. We feel like we failed, our bodies failed us, it's our fault. It's not your fault. So there's nothing you're going to do to make this happen. If you're having recurrent miscarriages or pregnancy loss, then you do need to see somebody to see if there's something that's going on that may be contributing to that, okay? I want to also put out there that seeing a high-risk pregnancy specialist, if you're having recurrent pregnancy loss, before you get pregnant is ideal. That way we can look at your previous pregnancies and determine if there's something that we need to do with the next pregnancy or even before the next pregnancy. So if you can, see a high-risk pregnancy specialist before you get pregnant again to see if there's anything that can be done. Let's see. Okay, so I'm going to wrap it up here. Again, guys, I am incredibly sorry that this did not work out. It's my fault. I thought that we could do a Facebook Live session together, but apparently we cannot. So I did the best I could, but I'm going to do this again. I'm going to get in contact with Parajet to reschedule, and we'll do it on Instagram Live. But this video here is going to go up on my YouTube channel, Shannon M. Clark, MD, and I'll have a link on Facebook and Instagram if you guys want to go back and look at this. Let's see. Yes, so Parajet is in agreement with me. See an MFM before you get pregnant again, if you can, especially if you've had recurrent pregnancy loss, or any pregnancy loss. If you want to get some questions answered, that's the best time to do it if you can. Amanda is saying she is 18 weeks and 6 days after 3 losses in a row. Oh, where'd you go? And anxiety is real. High risk. You're high risk with advanced maternal age and type 2 diabetes. I get it, Amanda. I see a lot of patients such as yourself, and the anxiety is real, but you got to do what you can to keep it. I'm not going to tell you not to be stressed out. I'm not going to tell you not to have anxiety. You're going to. But you got to do what you can to try to keep it at bay or as under control as possible. So I think even women who have normal pregnancies stress. So those of us who have high-risk pregnancies for whatever reason are going to be stressed. So again, Amanda, it might benefit you to go to Parajet's website to look at the resources she has. Okay, so Parajet is asking, for anyone who's nervous about a preconception appointment, here's a list of questions to take to your doctor to get info. So actually, I can't get to that, Parajet, so if you want to send me that list, I'll add it into the follow-up for this session here. Again, I'll post it on YouTube and online on Facebook and Instagram. So if anybody has any other questions, please go ahead and put them in now. I'm going to wait for a couple more minutes, and then I'll close this session, and I'm going to get with Parajet so we can do this the right way. But Parajet, thank you so much for hanging on and answering questions for me. I really appreciate that. And again, I'm sorry that I didn't know we couldn't do this. Does anybody have any other questions? If so, go ahead and add them. I'll wait a couple more minutes. Okay, I'm going to head out. If there's any follow-up questions, you guys can private message me on Facebook or Instagram, or email me at info@babiesafter35.com. Thank you so much for joining me, and again, I apologize for the mix-up. Bye, guys.